Good evening, Philippines and the world. Today is Friday, April 3, 2020. Join us for the next 45 minutes as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and live via streaming worldwide through UNTV News and Rescue Facebook account and UNTVweb.com. I am William Theo.
And here are the headlines.
The number of coronavirus cases around the world surpasses 1 million as the pandemic worsens in the United States and Europe. The Philippines joins the World Health Organization's Solidarity Trial to find a cure for the coronavirus disease 2019. The Philippine General Hospital will attempt to use convalescent plasma therapy on patients with severe COVID-19 symptoms. A COVID-19 task force advisor seeks to extend the enhanced community quarantine in Metro Manila to contain the coronavirus pandemic. The Department of Social Welfare and Development kicks off the distribution of financial aid to Filipino families in the cities of Manila and Parañaque affected by the enhanced community quarantine. And a Spanish actress and Instagram influencer returns to the nursing profession to help treat COVID-19 patients in Spain.
The number of confirmed coronavirus cases around the world has now reached a grim milestone after soaring past 1 million. Despite more than half the planet imposing some form of lockdown, COVID-19 claimed thousands more of lives, with the US, Spain, and Britain seeing the highest number of daily fatalities yet. Caslo Maraos details why.
The global coronavirus cases surpassed 1 million on Thursday, with more than 52,000 deaths as the pandemic further exploded in the United States and the death toll climbed in Spain and Italy. According to the latest figures from Johns Hopkins University, Italy had the most deaths, more than 13,900, followed by Spain. The United States had the most confirmed cases of any country, more than 245,000, the data showed. Amid unprecedented government steps to prop up economies battered by the outbreak, U.S. weekly jobless claims jumped to a record 6.6 million, double the record from the previous week. Morgues and hospitals in New York City, the epicenter of the U.S. outbreak, bent under the strain on Thursday, struggling to treat or bury casualties, as New York State's Governor Andrew Cuomo offered a grim prediction the rest of the country would soon face the same misery. In hard-hit Spain, the death toll rose to more than 10,300 on Thursday after a record 950 people died overnight, but health officials were encouraged by a slowdown in daily increases in infections and deaths. Spain has shed jobs at a record pace since it went into lockdown to fight the coronavirus, Social Security data showed on Thursday, with some 900,000 workers having lost their jobs since mid-March. Appearing for the first time since recovering from the virus himself, Britain's Health Minister Matt Hancock promised a tenfold increase in the number of daily tests for the coronavirus by the end of the month after the government faced criticism for failing to roll out mass checks for health workers and the public. Britain initially took a restrained approach to the outbreak, but Prime Minister Boris Johnson, who tested positive for the virus himself, changed tack and imposed stringent social distancing measures after modeling showed 250,000 people in the country could die. In Italy, which hit a daily peak of 6,557 new cases on March 21st and accounts for around 28% of all global fatalities, the death toll climbed to 13,915 on Thursday. But it was the fourth consecutive day in which the number of new cases stayed within a range of 4,050 to 4,782, seeming to confirm government hopes that the epidemic had hit a plateau. In Russia, President Vladimir Putin prolonged until April 30th a paid non-working period across the country, just a week after the Kremlin said there was no epidemic. There has been particular concern about the spread of the virus in countries that are already struggling with insecurity and weakened health systems. In Latin America, Ecuador said it was building a special camp for coronavirus victims in the country's largest city, Guayaquil, where more than 80 people have died. Brazilian President Jair Bolsonaro further played down the pandemic, telling church ministers it is not all it's being made out to be, and denying that any hospital in the country had reached full capacity. The first 100,000 cases worldwide of COVID-19, the respiratory disease caused by the coronavirus, were reported in around 55 days, and the first 500,000 in 76 days. Kat Dumaraos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, in the Philippines, 29 more people have died from the coronavirus disease as the number of cases continues to rise. The Department of Health today reported that the nationwide death toll now stands at 136. It also confirmed 385 new COVID-19 cases, raising the country total to 3,018. One more patient has been cleared of coronavirus infection for a total of 52 recoveries. The government aims to expedite the accreditation process of subnational laboratories in the country for improved coronavirus testing capability. Rosalie Cos explains why.
The Philippine government plans to begin the mass testing of patients under investigation and persons under monitoring for coronavirus on April 14, 2020. This is a significant step to prevent further spread of the infectious disease and to isolate and treat those who have been infected.
We're also determined to fast-track the accreditation of substantial laboratories so we can start to the massive testing of the PUIs and the PUMs. We expect that by April 14, we shall be able to start massive testing.
Meanwhile, the conversion of large structures in Metro Manila into quarantine facilities is expected to be completed in the next 10 days. Those are the Rizal Complex, World Trade Center, Philippine International Convention Center, and Cultural Center of the Philippines. 3 doctors and 50 nurses will be deployed to the Rizal Memorial Sports Complex. 1 million sets of personal protective equipment have been procured from China. 15,000 sets arrived on March 31 and the rest are scheduled to arrive from April 6 to 24. Soler Resort and Casino has committed 30,000 sets of PPEs, while business leader Ramon Ang has promised to buy additional 500 million pesos worth of PPEs. Secretary Galvez has also revealed that the Indian Commerce will procure 6 million masks to be distributed to 2 known drugstores so the public can buy at a lower retail price. Secretary Galvez is confident that although currently the number of deaths is higher than the number of recoveries from COVID-19, much more will recuperate from the infectious disease in the near future. Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippines is one of the countries that has joined the Solidarity Trial launched by the World Health Organization in search for COVID-19 treatment. This, as the WHO says, a vaccine against coronavirus is still at least 12 to 18 months away. Aiko Miguel details why.
Based on the World Health Organization's report, 74 countries have either joined to participate or are in the process of joining the Solidarity Trial for the discovery of COVID-19 treatment.
This is a historic trial which will dramatically cut the time needed to generate robust evidence about what drugs work.
Yesterday, the Department of Health announced the Philippines will join the multi-country clinical trial.
Si Dr. Marisa M. Alejandria ng Philippine Society of Microbiology and Infectious Disease ang ating kinatawan sa pag-aaral na ito. Makakasama rin niya si Health Undersecretary Rosette Vergeri na magsisilbing official liaison ng DOH sa WHO Solidarity Trial.
According to WHO Director General Ghebreyesus, 45 countries will contribute in the trial. 4 drugs will be included in the trial. These are remdesivir used to treat Ebola virus, combined lopinavir and ritonavir used for HIV infections. 2 drugs plus interferon beta is a molecule to regulate inflammation in the body, and chloroquine used to treat malaria.
One of the most important areas of international cooperation is research and development. A vaccine is still at least 12 to 18 months away. In the meantime, we recognize that there is an urgent need for therapeutics to treat patients and save lives.
WHO reminds the public not to patronize claims of treatment for COVID-19.
In the meantime, we call on all individuals and countries to refrain from using therapeutics that have not been demonstrated to be effective in the treatment of COVID-19.
WHO assures that although there is no shortcut for the discovery of treatment for COVID-19, experts are focused on finding cure at the soonest possible time. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Department of Science and Technology, or DOST, is set to begin next week a study to find out if virgin coconut oil could be used as a treatment for COVID-19. Joanne Nano tells us why.
The Department of Science and Technology is doing all preparations for the kickoff of the clinical trials on the use of virgin coconut oil to cure coronavirus disease. In an interview in the program Get It Straight with Daniel Razon today, DOST Secretary Fortunato de la Peña, the study will first focus on determining if VCO can be used as health supplement to fight coronavirus. If this turns out successful, they will continue the clinical trial to find out if VCO can cure COVID-19.
Sabi nga natin, hindi pa naman natin ini-eksperimentohan bilang gamot, kundi para muna maging isang health supplement kung talaga makikita natin nakakabuti. Para naman ma-i-apply ng approval sa FDA kahit health supplement man lang.
The DOST will be joined by the Food and Nutrition Institute to thoroughly examine the effects of VCO on the patient's health.
Kaya naman malakas ang loob natin mag-clinical studies dito. Ang VCO naman kasi ay walang harmful effects at walang toxicity. So, kailangan lang mag-agree yung ating mga pasyente. At ito naman ay dadaan sa ethical review board bago ito gawin.
Based on the initial assessment of the DOST, the clinical trial will last for a month. The DOST has also come up with new technology called RxBox, which was distributed to Philippine General Hospital. RxBox is modern machinery used to monitor the vital signs of patients, which is a big help for health workers in identifying the symptoms of a patient. The DOST is also working on a study to produce locally made ventilators for patients with severe COVID-19 cases prompted by the global lack of ventilators. Joanne Nano, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine General Hospital plans to use convalescent plasma therapy to help patients with severe symptoms of COVID-19 to recover. The method will be done in PGH under compassionate care. Vincent Arboleda tells us why.
As the World Health Organization speeds up efforts on the Solidarity trial to try and look for a cure that is clinically effective against the coronavirus disease, the number of COVID-19 positives continues to rise. But experts from Philippine General Hospital are now planning to use the blood of patients who have recovered from COVID-19 to help treat those with severe symptoms of the disease. According to experts, the blood of a person who has recovered from an ailment like COVID-19 has antibodies to fight the virus that caused the viral disease.
Yung antibodies nila sa dugo, pwedeng magamit ng ibang pasyente na may COVID-19. At yan ang hinahanap namin, yung mga may antibodies sa COVID-19. Tapos, itatransfusion sa mga pasyente na may sakit ng COVID-19.
This method is called convalescent plasma therapy. According to Dr. Jonas Del Rosario, spokesperson of Philippine General Hospital or PGH, the method is still in the experimental stage. That is why it will be done in PGH under compassionate care. The convalescent therapy has been done several times during previous outbreaks to treat patients when there was still no available medicine or vaccine.
May basis to kasi noon, yung mga ibang naging epidemic, like yung H1N1 flu, yung MERS-CoV, tsaka yung SARS, gumamit din ng mga plasma para magbigay ng passive immunity sa mga pasyente. Kasi nga yung antibodies nakakalaban yun sa virus.
Del Rosario added that the convalescent plasma therapy will only be used to patients with severe symptoms of COVID-19. With much need for blood plasma, the PGH is now calling for previous patients of COVID-19 who have recovered to donate blood. Those individuals must not have any symptoms of the disease for 2 weeks. The donated blood will also undergo regular blood screening to make sure it is safe and does not carry any infectious component that could get transmitted to other patients. If you are a COVID-19 recovery and wishes to donate blood, you may call or text 0917-805-3207 and look for Dr. Sandy Maganito. Vincent Arboleda, UNTV News and Rescue. We serve the people. We give glory to God.
Doctors and specialists explain that patients with severe symptoms of COVID-19 should be treated in hospitals and not merely at home. Let's find out why from Asher Kadapan Jr.
While there is no proven vaccine to fight coronavirus disease 2019 to date, hospitals apply symptomatic treatment on patients infected by the virus. This means a patient is given paracetamol for fever, while oxygen supplementation is provided to patients who are experiencing difficulty in breathing. If a person shows mild symptoms of COVID-19, the patient may be sent home to undergo medication while under 14-day quarantine. But if the symptoms escalate, the patient must be brought to the hospital under the care of specialists. This is where the role of hospitals come into play. Severe COVID-19 patients undergo intubation. In this process, a tube is inserted through a person's mouth and then into the airway, which aims to provide oxygen directly to the lungs to assist the person in breathing. The tube is connected to a specialized machine which can be done only in the hospital and not at home.
Bali po, yung makina po ang hihinga para doon sa pasyente. Kasi nga, kumbaga parang hirap na po yung ating mga muscles sa katawan na nagpo-control ng paghinga, parang hindi na kaya ng sariling katawan. Sinasubstitute ito yung proseso ng paghinga ng isang makina. So definitely hindi po yan pwede sa bahay.
If the number of patients severely infected with COVID-19 continues to increase, hospitals may need to augment their workforce. According to Dr. Dennis Daya-Wardoña, spokesperson of East Avenue Medical Center, some hospitals may accept senior high school students for administrative work, while graduates of medicine may also help with the technical work as they have been doing rotations in the hospital as clerks or interns.
In terms of management of COVID-19, and yun na nga po ang ating mga ginagamot sa ospital ay mga moderate or severe, kailangan po medyo espesyalista ang titingin sa ating mga pasyente.
Experts and authorities continue to appeal to the public to stay at home to help prevent the further spread of COVID-19. Asher Kadapan Jr., UNTV News and Rescue, Quezon City. We serve the people, we give glory to God.
The enhanced community quarantine all over Luzon cannot simply be lifted according to an official. This amid talks of whether or not the ECQ must be extended or not. Dante Amento tells us why.
In the program Get It Straight with Daniel Rason today, Dr. Anthony Liachon, the special advisor to the chief implementer of the National Action Plan for COVID-19, said that there are things to be considered before lifting the ECQ. These include no recorded additional cases, no new deaths, and many recoveries. But Dr. Liachon added, this is contrary with what is happening in Metro Manila. The number of cases continue to increase. 80% of the total confirmed cases in the country is within the National Capital Region. Dr. Liachon recommends to extend the enhanced community quarantine in NCR, which is supposedly to end on April 14. He did not give a timeline, but it depends on the situation, he said.
We must not rush into this. Ang isa pa ho, ang nagsabi World Health Organization 2 days ago na the Philippines is not yet ready for lifting the lockdown.
Based on his suggestion, the lifting of ECQ will be gradual or by phase. Areas with low or decreasing cases will be first.
Kung meron hong mga lugar na based sa demographics, bumababa ang cases nila, bumababa ang kanilang deaths, at mahusay ang pagpapalakad ng social distancing.
Meanwhile, the Interagency Task Force for the Management of Emerging Infectious Diseases still has no decision on the matter. Dante Amento, UNTV, News and Rescue, Quezon City. We serve the people, we give glory to God.
The PNP HPG personnel will begin to man checkpoints in provincial boundaries on national highways. But quarantine-controlled points in interior boundaries will still be manned by local police. Lea Ilagan tells us why.
The PNP Highway Patrol Group will be deployed to man checkpoint in provincial boundaries in national highways. Those areas will be called Dedicated Controlled Points or DCP. This is part of the new directives coming from Joint Task Force Coronavirus Shield Commander, Police Lieutenant General Guillermo Eliazar. According to PNP spokesperson, Police Brigadier General Bernard Banak, this aims to expedite the travel of cargo trucks carrying agriculture products.
So, ang lahat ng ating mga control points ay pangunahan na lamang ng Highway Patrol Group at lahat ng mga local police ay tinanggal na kanilang function dito sa mga control points na ito.
The national highways where DCPs will be installed are SLEX, NLEX, SETEX, TPLEX, Maharlika Highway and MacArthur Highway.
Ang pananatilihin na lamang ng mga provincial police at mga municipal or city police ay yung kanilang mga interior na mga boundaries at yung kanilang mga jurisdiction. Pero pag national highway yan, tanging ang HPG lamang ang siyang mamamahala.
Banak adds, the PNP leadership is giving the responsibility to the Highway Patrol Group because the Highway Patrol Group's function is maintain law and order on highways. The HPG will use motorbikes and cars to cross boundaries and immediately act on a specific problem that may arise at the checkpoints. Banak adds the HPG personnel are sufficient to lead the DCPs, but they could also ask for augmentation from the local police if needed. Lea Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The Interagency Task Force for the Management of Emerging Infectious Diseases launched its Rapid Pass system for motorists and residents with essential trips during the enhanced community quarantine period. Meanwhile, the IATF assures that the distribution of financial aid to household beneficiaries of the Social Amelioration Program will be organized. Rosalie Cos tells us why.
The government has begun the distribution of financial assistance under its Social Amelioration Program to the sectors worst hit by the COVID-19 crisis. The distribution of financial aid to household beneficiaries started in Manila and Parañaque cities. The cash assistance for beneficiaries in other cities is expected to come in the following days.
And we expect other jurisdictions to be distributing these to their residents in the next few days. Hintayin lamang po ninyo ang pakikipag-ugnayan sa inyo ng mga naatasang kawani hinggil sa sistemang ipapatupad upang maayos itong maipamimigay.
The beneficiaries of the Pantawid Pamilyang Pilipino Program or 4Ps are advised to wait for the government's announcement when the cash assistance will be deposited to their accounts. The Department of Labor and Employment encourages workers whose jobs have been affected by the enhanced community quarantine to submit a list of their co-workers similarly affected if their employers refuse to submit their payroll. This is for them to avail the COVID-19 Adjustment Program or the 5,000 peso one-time subsidy. Meanwhile, the government has also launched the Rapid Pass system to hasten checking and lessen person-to-person contact in quarantine control points. Rapid Pass system uses QR code scanners via smartphones, and authorized individuals or vehicles are issued QR codes. The Rapid Pass code can be requested by frontliners through the rapidpass.ph. QR code or control number can be printed and posted on the vehicles or can be presented through smartphone together with the ID. The IATF, however, clarified that a QR code is not required and an ID or documents can still be presented to pass through checkpoints.
Ito pong rapid pass system ay kinonceptualize po natin sa IATF para mapabilis ang sistema ng pag-check ng ating mga sasakyan at mabawasan ang person-to-person contact sa mga frontliners na gumagawa ng critical na serbisyo sa ating mga checkpoint officers.
Rosa Licoz, UNTV, News and Rescue. We serve the people, we give glory to God.
The Quezon City Government is appealing to its residents to have patience and understanding as it faces challenges in providing food packs to hundreds of thousands of families in the city. Harleen Delgado reports why.
Following reports of residents who have yet to receive food packs, the Quezon City Government is asking for understanding and patience with its distribution of food packs. In a statement, the city government made the appeal, noting that the need to source and deliver food door to door make the situation more difficult. According to the QC government, it initially targeted food provision for 400,000 families, prioritizing almost 200,000 indigent families and daily wage earners. However, barangay officials noticed a number of unregistered families, transients, and non-Quezon City residents during the actual food pack distribution. These include informal settlers, boarders and renters, laborers, and other individuals stranded in the city who were not included in the initial list submitted by barangays. The city government says this resulted in more requests from other barangays for more food packs. The local government adds it therefore increased its food pack target for batches 3 and 4 to 750,000, which it noted exceeds the estimated number of families living in Quezon City. Meanwhile, QC Mayor Joy Belmonte warns barangay captains and city officials to ensure proper distribution of food packs to the most affected families, or else they will face suspension. The mayor noted that barangay officials should set aside differences, adding that favoritism and politics have no place in times of crisis. As of April 1, the city government and its barangays have distributed over 1 million food packs. Quezon City's number of confirmed COVID-19 cases has reached 464. 14 have recovered, while 33 have died from the disease. Patients under investigation are at 76. Patients under monitoring, 416. 18 of the barangays that have COVID-19 positives have been placed under extreme enhanced community quarantine. Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
The Trade and Industry Department says the demand in sardines has doubled since the ECQ in Luzon began. Meanwhile, a consumers' rights group says the sale of sardines must be limited. Ray Pelayo clarifies why.
Canned sardines are frequently included in relief packages given to residents in areas where lockdown or enhanced community quarantine is being implemented. In fact, according to the Department of Trade and Industry or DTI, the demand for canned sardines has doubled since the start of ECQ or lockdowns. The DTI is strictly implementing a price freeze since the country has been subjected to a state of calamity. While according to Laban Consumer, the sale of sardines must be limited. Based on data from the Bureau of Fisheries and Aquatic Resources or BFAR, every Filipino eats 3.6 kilograms of canned sardines per year. The supply of raw fish for the production of canned sardines is enough, especially that sardines are on season now. The Zamboanga province supplies most of the raw materials in producing canned sardines. Filipino nutritionist Crisia Pailago says there are nutritional values in sardines including protein, omega-3 fatty acids that helps prevent heart disease and cancer, calcium and phosphorus that strengthens the bone and teeth, potassium that helps prevent heavy stress, sodium and lycopene. But eating sardines daily is not recommended, especially for those who have hypertension, heart disease, gout and kidney disease. There are alternatives to serving sardines. Cook them with malunggay, water spinach, pechay, and other green leafy vegetables.
So basically, ready to eat na lahat ang mga ito. Pero i-highlight lang natin na mas mainam na gamitin itong pangsahog o pampalasa sa iba't iba pang kayang i-prepare natin na ulam tulad ng gulay. Dahil nga naman iisa ang lasa nito at saka may kaalatan.
Some of the tips before buying or eating canned sardines are: check the expiration date, wash the can before opening, smell if it has a foul odor or unpleasant taste, avoid buying deformed cans because they may be contaminated with bacteria. Avoid rusty cans. Be sure that when kids are eating sardines, watch out for large fish bone. Ray Pelayo, UNTV, News and Rescue. We serve the people, we give glory to God.
Although Meralco will charge its customers during the enhanced community quarantine period based on their average consumption in the last 3 months, the customers will not suffer any loss. Joanano explains why.
Manila Electric Company or Meralco has temporarily suspended physical meter reading of customers' power consumption since the ECQ began. This move aims to prioritize the safety of the company's personnel from coronavirus infection. This is also to comply with the government's ECQ protocol. The power distributor will base the electric billing of its customers on their average consumption in the last 3 months, which is in accordance with the law under the Energy Regulatory Commission. But if a customer has left his house temporarily and spent the home quarantine period somewhere else, or if an establishment has been closed due to the suspension of its operation, will they still be charged for power consumption? Meralco answers that once the situation normalizes and the actual reading is done, corresponding charges will be applied and any adjustment will be reflected in the next billing.
Kung sakaling bakante na pala ang bahay o nagkaroon ng pagbabago sa consumption ng customer sa buwan kung saan hindi siya nakuha ng actual reading, asahan po ninyo, magkakaroon ng automatic na magre-reflect sa next bill ang difference niyan as long as based na sa actual reading ang susunod na billing. So hindi po malulugi ang customer dahil magre-reflect pa rin naman ang actual na consumption once na makuha na yung actual meter reading pagtapos na po itong ECQ o itong Enhanced Community Quarantine.
Meralco also assures there is enough power supply so there will be no power disruption during the ECQ.
Well, right now, the supply is more than adequate sapagkat mababa po ang demand. As far as the Meralco service is concerned, we're continuing to provide 24/7 service. Diyan po kami nakatuto ngayon. Umasa po kayo na ang inyong kuryente ay hindi mawawala at patuloy po yung magiging serbisyo namin. We will keep the lights on.
The Interagency Task Force for the Management of Emerging Infectious Diseases says that payment for water, rental, housing loan, and other utilities will be deferred until the enhanced community quarantine is over. Joanaro, UNTV News and Rescue. We serve the people, we give glory to God.
"3D printing has gone to another level of use. Some Filipino groups turn to their 3D printers to help our new generation of heroes. Nina Armilio details why.
3D printed face shields are used not just in Greece and in the USA, but also here in the Philippines. A local startup called MetaTech Lab has come up with a way to use its technology and capabilities to help in the country's fight against COVID-19. The Research and Development Group was formed weeks before the coronavirus pandemic began. It has partnered with the University of the Philippines College of Engineering for this charity project. Grade 10 student Marcus Chu is one of the first volunteers of this initiative.
I feel like it's my opportunity to finally help in a very serious situation, even if it's in just a little way.
Marcus says he has assembled dozens of face shields using his design and a 3D printer gifted by Miss Joanna Ongo, who has received acetate donations from private individuals. Healthcare workers in St. Luke's have received face shields assembled by Marcus, according to Miss Joanna's post. In the Visayas region, A volunteer group called NVC, or Negrense Volunteers for Change Foundation, has also created 3D printed face shield frames, which they plan to multiply to be given to COVID-19 frontliners. NVC has also created handmade PPE gowns. It has so far delivered thousands of floral gowns to several frontliners. This is their colorful way to send a message to medical frontliners they are rooting for their success in this battle. These donations come with heartwarming messages and words of encouragement from the group's volunteers. Another advocacy group was formed due to the national health emergency we are facing. 3D Printing for a Cause PH aims to produce and donate 3D printed face shields to frontliners. It has so far given more than 9,000 face shields in the past 2 weeks. 3D Printing for a Cause PH now has 1,200 members and 200 3D printer volunteers. These groups and more are driven by their desire. The group calls for materials and monetary donations that in their own little way, they could take part in the battle against the unseen enemy and to fight to save lives. Nina Armilio, UNTV, News and Rescue. We serve the people, we give glory to God.
An ocean liner forced by a deadly onboard coronavirus outbreak to languish at sea since mid-March pulled into a South Florida port after authorities settled plans for the vessel and its sister ship to dock and most passengers to come ashore. Beverly Saison details why.
Florida officials on Thursday allowed 2 Holland America cruise ships with coronavirus patients aboard to dock at a port near Fort Lauderdale, resolving a days-long impasse that drew the attention of President Donald Trump. A unified command consisting of local, state, and federal officials met via conference call late Wednesday to finalize a plan to allow the ships to dock. The tentative agreement allowed the cruise lines Rotterdam and Zaandam ships to dock at the Port Everglades in Fort Lauderdale after 27 days at sea. 4 passengers aboard the Zaandam have died, 2 of them after becoming infected by the coronavirus. Though the details of the plan have yet to be released, Holland America said in a statement on its website that more than 1,200 passengers from both ships would transfer straight to charter flights to their homes. About 45 passengers will stay under quarantine in the Zaandam ship, and about 10 passengers who are in critical condition will be transferred to area hospitals. The deal comes after Trump earlier this week urged Florida Governor Ron DeSantis, a fellow Republican, to drop his opposition to accepting the ships. DeSantis initially opposed the ship's arrival in his state and told Fox News this week he did not want passengers to be dumped in South Florida. The nation's top infectious disease officials also urged that passengers be taken off the ships as soon as possible to prevent further spread of the highly contagious virus. Beverly Saison, UNTV News and Rescue, USA. We serve the people. We give glory to God.
The novel coronavirus has been hitting the city of New Orleans much harder than the majority of the U.S. As of Wednesday, the death rate per capita is almost 3 times that of New York City, the current epicenter of the virus in America. Riz Cassin reports why.
The coronavirus has been a far deadlier threat in New Orleans than the rest of the United States, with a per capita death rate 3 times that in New York City. Doctors, public health officials, and available data say the Big East's high levels of obesity and related ailments that make patients more vulnerable to COVID-19, the highly contagious respiratory disease caused by the coronavirus.
Obesity helps cause diabetes, which helps cause kidney issues, and we know that the coronavirus attacks kidneys. Obesity is also linked to heart disease. Heart disease is also linked to poverty. So all of this leads to the perfect conditions for chronic disease. And what we're learning about this virus is that it is opportunistic and that it is very deadly to people who have multiple organ disease.
New Orleans, which so far has reported more than 270 coronavirus deaths, could be a harbinger for the potential toll the pandemic could take in other parts of South and Midwest that also have high rates of obesity, diabetes, and hypertension. The Centers for Disease and Control Prevention released for the first time this week a report showing that 78% of COVID-19 patients in ICUs in the United States had an underlying health condition, including diabetes, cardiovascular disease, and chronic lung disease. The CDC report was based on a sample of under 6% of reported coronavirus infections, but the doctors in Louisiana said it was consistent with what they are seeing, and it is in line with what other countries like Italy and China have faced.
I think it's a very good question whether or not just having that phenotype, those conditions simply render you less able to control the viral replication, whether something about the immune response in those individuals that is either insufficient or maybe even perhaps excessive, causing too much inflammation. We think that a lot of the organ dysfunction we see in this COVID syndrome is the result of excessive systemic inflammation. We know that folks that are obese a lot of times have markers in their blood of excessive systemic inflammation.
The New Orleans Metropolitan Statistical Area ranks among the worst in the United States for the percentage of residents with diabetes, high blood pressure, and obesity. CDC data shows an estimated 39% have high blood pressure, 36% are obese, and about 15% have diabetes. Nationally, the median is 32% with high blood pressure, 31 obese, and 11% have diabetes. Grace Cassin, UNTV News and Rescue. We serve the people. We give glory to God.
Residents at a slum area in Brazil have taken things on their own by hiring around-the-clock private medical service to deal with the coronavirus cases in their area. This as their anxiety and deep mistrust grows against President Jair Bolsonaro. Jovic Bermas reports.
Sandwiched between luxury apartment blocks and high-walled mansions sits Sao Paulo's largest slum, Parisopolis. Here, coronavirus is starting to make an appearance. Due to this, the Association of Residents of Parisopolis formed a coronavirus response team, including 3 ambulances, 2 doctors, and 2 nurses, as well as drivers and support staff. While President Jair Bolsonaro has dismissed the virus as a little flu and told Brazilians to get back to work, Barata is sleep-deprived, trying to get his favela ready for what he describes as a war.
The work we are doing for Paraísopolis is like a war scenario. If Brazil today is at war, the favelas are at war 2-3 times more.
Barata declined to say how much the private medical service would cost or how it was being funded, beyond saying some was covered by donations. The medical team is on an initial 30-day contract, likely to be extended. The population density in Parisopolis is about the same as Manhattan. Residents complain the water runs dry after 8 p.m. and rubbish piles up along the tight dump alleyways that weave through the community. Roberto de Souza, 41, believes he caught the virus through his job in a pharmacy, despite wearing disposable gloves and a face mask when serving customers. After testing positive, he isolated himself in a cramped second-floor flat in Parisopolis.
I am not concerned about myself, but about my children, my family, people who depend on me. I have small children. I have Miguel, Bianca, Jonathan. They need me, and I believe that I will. I will be able to teach the good ways to my children.
To address that challenge, the Residents Association is looking to use 2 local schools to house up to 500 suspected and confirmed cases without life-threatening symptoms, removing them from tight living quarters. Despite all the preparations, Barata is worried residents are not taking the threat seriously enough. Unlike in the rest of Sao Paulo, where a lockdown is in place, most bars and shops remain open in Parisopolis. The streets bustle, parties pound. Barata fears many will change their attitude only once a parent or a friend dies. By then, it might be too late. Brazil is Latin America's worst affected nation by the coronavirus so far, with nearly 7,000 confirmed cases and 240 deaths. Jovic Bermas, UNTV News and Rescue. We serve the people. We give glory to God.
A Spanish actress and social media influencer returns to the nursing profession to help treat COVID-19 patients. Mirasol Abogadil has the story.
A Spanish actress and social media influencer tells about how she felt compelled to put her career on pause in order to go back to frontline nursing amid the coronavirus crisis. Despite fearing for the safety of her two daughters, Gemma Marin made the decision to return to hospital wards after 10 years away from her former career as a nurse.
You cannot stay at home when something like this is happening.
Marin said she had sent her resume to hospitals on Sunday, March 22.
So next day, Monday morning at 9 a.m., they called me, please, can you come work this afternoon? I was like, today? It was, yes, as soon as possible.
The 33-year-old influencer has joined the nursing staff at a public general hospital, the University Hospital 12 de Octubre, in the neighborhood of Orcasur, Madrid. Marin hopes that regardless of the long break, her help will be useful. Apart from her daily duties, she managed to organize a video call for a dying COVID-19 patient of the hospital and his family based in Canada, thanks to her presence on social media. Marin is known for her work as an actress and has appeared in the movies Tierra de Lobos, Cuenta Atrás, and Drones Don't Fly When the Sky is Gray. She has also gained popularity on social media thanks to her viral dancing videos, counting 299,000 followers on her Instagram account, and she plans to work again as an Instagram influencer when the pandemic ends. Mirasol Abogadil, UNTV, News and Rescue. We serve the people. We give glory to God.
Justin, the Philippines Food and Drug Administration has approved the commercial use of the test kits developed by scientists from the University of the Philippines. It is the first locally developed PCR-based COVID-19 test kits. The test kits will be manufactured by Manila Health Tech Incorporated.
Our kasambahay, we are at a time when the country is under a state of health emergency. The cooperation of all Filipinos is imperative to avoid the deadly virus. We are calling on everyone to be calm.
And most importantly, let us join together in prayer for our country and for the whole world to survive this crisis. You may join us in our daily UNTV community prayer at these hours as flashed on your screens. And those are the reasons behind the news. I am William Theo. We serve the people. We give glory to God.
And I am Angelo Castro III, because we need to know. We will always ask why. Good evening.